Thank you, Gursimran. I hope I'm audible.
Yes.
So, good afternoon, everyone, and a very warm welcome to today's session on promoting transparency in disaster risk management. My name is Kripa Lakshmi, and I am Program Associate at Sphere India. I work closely with collaborative advocacy and communications, and it is my pleasure to moderate yet another session of Sphere India Academy. And today's discussion is very important, and it aligns closely with one of Sphere India's key verticals, accountability to affected population. And at the heart of accountability lies transparency. And disasters do not test the resilience of our systems, but also the trust we build with communities. Transparent practices, whether in sharing information, decision making, or resource management, are creating disaster risk management systems that are just inclusive and effective. Through today's session, we aim to reflect on the current challenges, explore promising practices, and chart pathways towards building disaster management efforts that are open, participatory, and empowering for all. And today we have a very rich panel of experts, and we have them already joined here. Dr. Henna, Mr. Joe George, and Mr. Mihir sir, and Marshal sir from SL will also be joining us in a while. So today's webinar will begin with the session of Dr. Henna, and Henna ma'am will be setting the context for today's webinar, and she'll also set importance of how transparency is in disaster context. I'll just take a minute to introduce Henna ma'am here. Dr. Henna Hejazi is a seasoned humanitarian and disaster risk management professional with over 17 years of experience, including 12 years of dedicated to principal humanitarian action and implementation of humanitarian standards across disaster and emergency contexts. As the program officer of humanitarian response at Change Alliance, she leads strategic efforts in project management, advocacy, and capacity building. Dr. Hejazi has successfully managed multi-sectoral interventions in India, Nepal, Bangladesh, and Kenya, spanning emergency response, resilience building, recovery, gender in DRR, security support, SRH in emergencies, health emergency preparedness, and child protection. He has worked with leading organizations including us, ActionAid, ICRC, UNFPA, WHO, and Pragya, driving inclusive and rights-based approach to humanitarian action. I am very happy to welcome Henna ma'am to yet another very important discussion. And, over to you, ma'am. You can take the discussion
Thank you
forward
so
from
much,
here.
Krupa. Thank you all. Thank you for coordinating and setting up the first in a series of a topic which is talking about transparency and accountability in disaster risk governance and contexts. So a very, very important, a very critical topic. While you were introducing me, Krupa, just to also explain to everybody here that while working with Spear, I used to lead the accountability vertical, a very, very important vertical. In the sense that my first question is also linked to that on why transparency matters in disaster contexts. While looking and dabbling in this particular vertical and theme, we were trying to look into multiple aspects of how to engage better and how to establish a two-way communication with the communities. Second, how to set up an interagency mechanism on complaint and feedback so that the communities which are impacted by disasters and emergencies can provide a timely feedback to necessary agencies and authorities. The third one was talking about the adherence and implementation of the humanitarian standards and minimum standards, and we have so many of them. Spear minimum standards, we have core humanitarian standards, we have interagency standing committee standards, and certain principles that set out our work in the humanitarian division. We were also looking at how to institutionalize the rights to crisis tool, which we very successfully tried to implement in certain contexts of the country and have taken quantum leaps on adopting that. So these were some 4 or 5 basic pieces of work that we were working under SPEAR. But when we talk about accountability, I am reminded of the Rwanda genocide, which started on 7th April 1994, which represented a turning point in the history of humanitarian sector and was a catalyst to improving the quality and accountability of the humanitarian aid. I know that many of the people here know about the joint evaluation of emergency assistance to Rwanda, which was the first, initiative to set out a message in terms of instituting accountability mechanisms in the humanitarian community. And accountability to affected population is an active commitment for aid workers and organizations to use the power and resources entrusted to them ethically and responsibly, combined with effective and quality programming that recognizes the community's dignity, capacity, and right to participate in decisions that affect them. Being accountable means 3 things: giving account, taking account, being held to account. Giving account means providing information to affected communities about humanitarian agencies' activities in formats, in languages, in narratives which they prefer, not which we prefer. Taking account means ensuring decisions of the humanitarian agencies are informed by the views of the affected communities, and being held to account uh, means that enabling affected communities to assess and comment on agencies, which might be sometimes donors also, performance, including on sensitive matters. I'm very, we all talk about the core humanitarian standards, but I would also like to reiterate and emphasize the 7 pillars of accountability, ranging from participation to information and communication to feedback and complaints to protection from sexual exploitation and abuse to strengthening local capacity, evidence-based advocacy and decision making, and coordination and partnership. These 7 pillars of accountability set out the basic framework, the basic implementation plan and strategy of how we as responding agencies, as SPEAR members, as humanitarian practitioners start building on each one of these pillars to ensure that we institute safe, appropriate, equitable, inclusive opportunities for the affected communities to participate in decision making. And when we institute verbal information and communication mechanisms within the communities, which can be face-to-face interactions, focus group discussions, complaint, mechanisms and feedback mechanisms within the community. We also ensure that we are informing, keeping the communities well informed of a system and an approach whereby we communicate and we establish that accountability mechanism very effectively. Now, on the feedback and complaint, I will give some inferences of some of the disasters, sometimes in Uttarakhand and sometimes down in south, where we were grappling with how to establish and institute an interagency complaint and feedback mechanism. And because we are, coming out with some, thoughts and ideas of how we could, as, an interagency group, which is present at the state level, come out with some dedicated helpline numbers who are working in tandem with the emergency operating centers and collecting and sharing this information on the feedbacks on a regular basis with the state and the district authorities. We could very successfully come out with this in one or two states, but I think there are a few difficulties which our panelists would like to kind of also take us through, and I'm sure they would also be touch basing on how to maintain a better coordinated and effective mechanism. I see Joe George is here from KSDMA, and in Kerala, Spear was also trying to provide some orientation on for the EOC members on better call management mechanisms, because Kerala, being a tourist state, had a lot of people who were having different languages, and at the time of any emergencies, that feedback was very important. So, on strengthening local capacity, we need to work very closely and through the local actors in creating formal, informal community structures and networks, as we have SPEAR as a national coordination mechanism, and similarly narrow down at the district level on creating such mechanism and investing in emergency preparedness, capacity building, resilience efforts, and all of that. Now, sometimes evidence-based community engagement and advocacy helps in better decision making. Sometimes it's also our responsibility to communicate to the duty bearers, to the service providers, to other relevant stakeholders on behalf of the vulnerable people and communities to address their priority needs and concerns in ways that respect their rights and dignity, including the right to participate in decisions that affect them. Uh, mm, Many a times this kind of work has been instituted in several disaster contexts by many members, many organizations, but I think we need to also in today's session touch base on how an institutionalized approach through harmonized systems and mechanisms can be can pave a way for better effective coordinated responses. And last but not the least, coordination and partnerships with communities, local, national, international actors and networks to minimize gaps and duplication and maximize the quality, coverage, reach, and effectiveness of humanitarian and development programs. I would also like to touch base on the need for collective approach to managing feedbacks. Communities see all response actors as a single entity. When we communicate and gather feedback from the communities in a consistent way, we show that we are unified in our mandate to listen and respond to their needs. Second, we are a diverse response community. There's abundance of rich but decentralized information we can harness about the needs, perceptions, and experiences of the communities. And this is what would also pave way for trust, which Krupa was talking about at the outset only, and we can be more confidently interpret and triangulate feedback together with other information to meet both strategic and operational decision making. I would briefly conclude by talking about my own organization, whose accountability approach is anchored on the essentiality of communities being in the driver's seat of their own change, informed by our global analytic framework on poverty, power, and prophetic wise, and our commitment to decolonial accountability approaches. We value and act on what communities tell us by writing it down, tracking feedback, analyzing trends to inform learning, and adapting and improving our programs based on the feedback received. We use a digital feedback case management and learning system that has online and offline functionality. It has a user-friendly interface that supports case management, generates feedback, reports, enables data visualization using multiple input channels as prioritized by the communities. The system maintains a clear audit trail of what has been done with a piece of feedback, when and by who, from collecting the data to tracking trends, generating reports, taking action, to addressing the feedback, and finally closing the loop through feeding back to the communities. This digital tool is rolled out in 15 countries, and sometimes we look at the referral pathways, and there have been some challenges that we have come across in terms of engaging and connecting with relevant support services, to sometimes looking at the nature of feedback, which can be health related, legal related, police related, any thing related. In that, we were also inspired trying to look into how to get in touch with state and district grievance redressal mechanisms and other support services to kind of see how these feedback mechanisms are instituted effectively. I would share more details as we hear from other panel members, but uh, with this, I'll hand it over to Krupa at this stage. Over.
Yes, thank you so much, ma'am. Thank you so much for talking about accountability, the pillars of accountability, and community involvement also, because you have paved way for the next webinar. We were planning in the series, as you know. So also talking about organizational practices, our next section of the webinar is about organizational best practices, where we have Mr. Mihir Bhatt, sir, talking about organizational best practices and examples of transparency in practices. And he's also going to talk about community-driven data sharing and participatory approach. So I like how the narration of the webinar is going in the right flow. Thank you, ma'am. I'd like to take a minute to introduce Mihir, sir. Mihir Bhatt, a founding member and active member of SPARE India and director of the All India Disaster Mitigation Institute, has pioneered accountability to affected populations since Gujarat earthquake of 2001. Currently, sir is working on making amended National Disaster Management Act effective at community level and helping state disaster management authorities develop extreme heat management plan and anticipatory action roadmaps. It is so nice to see such an expert working in all the current world issues like right now that is going on. Over to you, sir.
Thank you. Thank you, Krupa Lakshmiji. Thank you for it. Can you hear me clearly?
Yes, sir. You are loud and clear, sir.
Good. So thank you for working out the flow of the today's session so well. And as always, Henna ji has covered very well the picture about both what are the frameworks available, some of the tools, some institutional history as well. And so keeping that in mind, I'll build further on promoting transparency in disaster risk management, being accountable to affected population. And what I would do is take out key action points to promote these and give institutional examples for each of the, I have taken out 5 action areas. For each of that, 3 examples, one from the National Disaster Management Act what is the Act say for both of this, because that's so important. We work in the national framework to make India safer. Second, the civil society sphere India as a important coordinating an important network. And what is the experience of sphere India, by which of course I mean all the members and their individual experience in their respective communities. And then an example from our own work. So I'll give 3 examples for each. I don't need to emphasize further that transparency is the cornerstone of effective disaster risk management. And we have found this since our first response in 1995. And this has always been very important cornerstone, and it always makes or breaks the disaster response and recovery in a positive or negative way. The 5 key areas, let's focus on that first. And the first is the establish clear communication channel to the last affected person. And by the last affected person, in our case, we mean, of course, women, we mean minorities, minorities of all variety, we mean the migrant labor for Indian situation, and of course, tribal population of India. So these are the groups that are having clear communication channel for that. The NDMA Act very clearly says and gives the mandate for all disaster authorities to create multilingual communication hubs and mobile alert system accessible to migrant workers, slum residents, and indigenous communities. So this is something the Act has very clearly said. The Act is in force now, and all the state authorities and the partners that they work with, such as IAGs of Sphere India, they need to focus that. In many states, this is happening, and this needs to happen far better and far more effectively. The Sphere India example, I'd like to give what they call the Common Minimum Standards Charter, and which is what Henaji just mentioned. And that ensures that all humanitarian actors commit to information dissemination in local languages during disaster response. And here, I would also like to compliment Sphere India for taking at least some of the IAGs, taking it beyond disaster response to also preparatory part of it. That is that when while you prepare for upcoming floods, for example, in Assam, the IAG there is making sure that the establishment of clear communication channel is there. So that's an example from Sphere India. And the example from AIDMI's example. And for each of our responses that we have done, but we are an action research organization. So also our learning and research activities, we have what can be broadly called as local watch groups or community feedback group. And they in the disaster prone regions. And we ensure that real-time multilingual warning reach vulnerable population via SMS, mobile apps, and local media in pilot projects where we are working currently on small businesses affected by extreme heat. So that's an example, 3 examples of establishing clear communication, and that's something very important, both for transparency and accountability. The second equally important is implement community feedback mechanism run by affected population. And Henaji very clearly mentioned that in her presentation, that why it is very important to have this feedback. I'll give an example first to start with National Disaster Management Act. And the section 19B of the amended act requires that all relief camps set up grievance redressal desk managed by partly at least the local community volunteers, enabling immediate feedback to our district authorities. And this is something mandated by the act of our national government. And this is something must be done and is being done. The question is that how do we improve the quality of these actions that are being taken under Section 19B? I don't think anybody really doubts or doesn't want to implement, but partly because of resources, partly not knowing how to do that, partly not having people on the ground, partly not building partnership with local civil society organizations. But this doesn't happen as of a high quality as it can be. So that is something to keep in mind. The Sphere India itself during COVID-19, and at that time, Dr. Henna was very much in the leadership position there, established community listening posts where citizens directly submitted feedback on health and relief services. And maybe if we have time, she can give more example of that, or maybe you can send an email to her and she'll be able to share with that. But that experience of COVID-19 of Sphere India is very important. And that is something that we all can learn from and replicate that, duplicate that in various work that we do. From AIDMI's own example, what we call People's Recovery Audit, broadly speaking, was initiated in 2002, deployed community-led feedback system in 11 international NGOs, which were supported by Disaster Emergency Committee. And we were invited to put this design, develop, and deploy this particular People's Recovery Audit. How will it work? How that rating will be done, etc. Subsequently, a lot of good work is done, and now it is mainstream. An interagency steering committee uses it. The Sphere Standards implementation part also uses it. The CHS, the revised guidelines have also suggested ways of doing this. And of course, ECWA, ICVA is also doing that. The third example of transparency and accountability, which is very important, is public disclosure of aid and resource allocation. And here I would give National Disaster Management Act example, that the new rule under Section 29A stipulates that all disaster recovery expenditures must be publicly disclosed every quarter on government portals, including beneficiary list. And this is something very much given for the civil society. And we hope that such expenditure by the local authorities, state authorities, and other organizations would also be easily available on the portal, so that the affected population, to whom we all are accountable, has a clear picture of what needs to be done. There is some very good work that is being done by what is now called Humanitarian Hub, and HAI organization is leading that, where they have started collecting statements from the aid resources that are received by a specific organization for specific purpose. There is a danger of these organizations being persecuted or mishandled because of the financial details available. And that is something which needs to be added to the Section 29A in terms of rules, that how do you protect those who disclose. The Sphere India's own work in terms of interagency coordination cell regularly publishes relief distribution updates and gaps analysis during national emergencies like Cyclone Fani, most importantly that I remember, and Kerala floods. But obviously, Henaji will have more examples, and of course, you can ask Sphere as well. But that is something which can be very easily make a regular practice in disaster response in India. AIDMI's experience in, we have pioneered, if I may use that word, in participatory budgeting process in the Gujarat flood recovery program since Surat plague that took place, and posting detailed fund utilization charts in panchayat offices, local cooperative offices, and other NGOs. This particular local budgeting could be taken to all the interagency groups, should they be interested. Could also be taken to district disaster management authorities if they are interested, but the work is there and it could be used for increasing accountability and transparency. The fourth is including direct participation of most affected in planning and decision making. And here it's very important that the NDA, National Disaster Management Act, directly directs that at least 30% of the members in state and district disaster management authorities must be from affected or vulnerable communities, women, persons with disability, indigenous groups, etc. And how do we operationalize and institutionalize this part is a major task that is ahead of us. And that will make the humanitarian response in India something which perhaps world over has not been done at this scale and with this commitment. The second example from Sphere India is that task force on inclusion ensures that humanitarian response plans embed the perspectives of marginalized groups through consultative pre-planning workshop. And this is something very important. And our own AIDMI's example for the inclusive direct participation is what we call climate adaptation planning project since 2014, includes women's collectives and fisherfolk unions as equal partners in resilience planning and project design. So these are the three examples for the inclusive direct participation of most affected in planning and decision making. And fifth and last, and I will end with that, is the independent monitoring and social audits. This is very important because it gives a feedback, tells us the quality of work that is to be done, and also helps us plan better so that each time we respond better. And for that purpose, the National Disaster Management Act, the new section of the Act, e.g., for example, Section 45C requires annual third-party audits of disaster recovery programs by accredited independent bodies with results made public within 90 days. And this is very important item that has been included. Similarly, Sphere India's example has promoted humanitarian accountability partnership with independent academic institutions to evaluate program impacts after major disasters. Sphere India has kindly invited us from time to time to either evaluate some of the work of its partner, a group of partners, and we have found that whole process very open and very eager to learn from what findings have come out. Sometimes the findings are not necessarily very complimentary as they should be, but they are received well and are incorporated into the various memberships of Sphere India and interagency groups. And we look forward to doing that more often in some of the areas where perhaps it is needed more, especially around extreme heat related to some of the initiatives that the members of Sphere India are taking. And AIDMI's own example on this count is that we have set up what is called community oversight committees to lead real-time audits of tsunami relief effort in Tamil Nadu in 2004, which was a new idea. The state ministry at the time had accepted that. Subsequently, I understand, I'm not 100% sure, that the Bedrock organization which came out, and that has been taking also addressing this issue of third-party audit or review, evaluations, objective lessons learning, whatever we call it. But that is something happening, and that is very good. So I'd like to end by saying that integrating these 5 actions with practical examples from national law, coalition work, such as for Sphere, and community-driven initiatives such as ours, disaster risk management system can uphold dignity, strengthen resilience, and truly serve the needs of the people most affected. And that is what we all want. Transparency transforms recovery from a top-down process into a collaborative, lasting, and cost-effective resilience building pathway. And that is what something that we all on the panel, as well as the members who are the participants here want. Maybe time has come for Sphere India and the panel members, ourselves included, to take these ideas ahead from policy to operational reality by drawing a collective roadmap for India in terms of increasing transparency and accountability under the umbrella of new amended National Disaster Management Act. Thank you very much. And over to you, Kripalakshmi.
Thank you so much, sir. Thanks a lot for being very specific in your points, and thanks for quoting the DM Act and walking us through it, and how CSOs and any accredited body can be involved in being transparent in terms of humanitarian response and disaster management. And thanks a lot for quoting all the examples of Sphere India. I mean, uh, all the examples you have told us has been very inspirational. And going forward, I would like to take the point of where you told about the participatory consultation and how even the last affected population, last affected person should be involved. And when we talk about vulnerable communities, we cannot just ignore person with disabilities. And our next section of the webinar is about just that. And we have Mr. Joe George. Sorry, sir. I'll just take a minute to introduce George. Mr. George has been working in the field of disaster risk reduction and climate action for over 18 years. He has worked with UNICEF, UNDP, Kerala State Disaster Management Authority, World Vision, etc. in different parts of the country. Sir's expertise lies in inclusive DRR, especially in disability inclusive disaster preparedness and climate change adaptation. Sir has authored a handbook on disability and DRR in 2016 while implementing the DIDRR project for the KSDFA. He is an alumnus of the International Visitor Leadership Program of the US government and a cohort of Climate Action Champion Network in South Asia. He's an awardee of the 2022 NCPDP Universal Design Awards on Disability and DRR. Congratulations to you for that, sir. There is no other best person that could talk through this than you. Over to you, sir.
Good afternoon, everyone. Thank you, Kripa, for the detailed introduction. And good to see Mihirji and Dr. Henna in the panel. So, I would be talking about disability inclusive transparency in DRR. As already Dr. Henna and Mihirji have laid the context regarding transparency in disaster risk management. I would be talking more on disability inclusion, as has been entrusted to me. At the outset, I would like to show some numbers, some speaking numbers. In the World Disability Report of 2011, 15% of people are living with some form of disability. The WHO report says that 16% of people around the world live with some form of disability. When we come to India, you look at the disparity of numbers. Only 2.1% are persons with disabilities. That also according to the National Census 2011. We are long overdue for another census. And I also took a couple of states, that is, one is my own state, that is Kerala, again 2.23, and Tamil Nadu 1.6%. If you look at any state, for that matter, it is around 2.2, 1.8, 1.9, like that. According to the Rights of Persons with Disabilities Act 2016, 21 types of disabilities have been enlisted. So when we talk about disability, for example, disability pension, which is given in all the states with the benchmark disability of 40% and above, those people should fall under these 21 types. And there was another legislation which was before this, that was the PWD Act of 1995, wherein only 7 types of disabilities were enlisted. So now there is a comprehensive list of disabilities. And why do we speak about disability inclusion in disaster risk reduction? Mostly because they are disproportionately affected. If you look at any disaster, we can it's a proof that the disability inclusion is needed. Most of these people are quite invisible. They are a minority, as we looked at the statistics. They are mostly out of sight, though we talk about inclusion, though we talk about community engagement and all that. Many of our government as well as NGO programs and trainings and discussions, we overlook the active participation and decision making by the persons with disabilities. And of course, every life counts, and as UN SDG 2030 motto says, leave no one behind, when disability inclusion is very much critical. The UNCRPD Article 11, it mentions that all state parties should be taking all necessary measures to ensure protection and safety of persons with disabilities. And for us in India, we have this strong legislation of RPWD Act. In the section 8, it says about protection and safety of persons with disabilities. And it mentions that every person with disability should have equal protection and safety. And point number 3 mentions that DDMA constituted under section 25 of the DM Act. It is now amended, as you all know. Every district should be having the details of persons with disabilities, which is not so. I'm sure many of you are working with DDMAs. You can check with your DDMAs whether they have the list of persons with disabilities with them. That itself is a challenge. Referring to one of the most recent UNDRR study report, the 2023 Global Survey Report, which is second in the series. The first one was in 2013. It gives you some speaking numbers again. We can see that 84% of persons with disabilities do not have any personal preparedness plan. And 56% are not aware about or they do not have any access to disaster risk information. 86% of PWDs reported no participation. I'm just connecting it to the previous slide, which I was referring to that. No participation in community level DRR decision making and plan. I'm sure many of the participants are from NGO backgrounds, USO backgrounds. So it is an eye-opening statistics to us. The Sendai framework also talks about transparency and accountability, risk governance, and all that. So I would be talking more about the transparency in sharing of knowledge and risks to persons with disabilities. Mihirji had spoken already about the financial accountability and transparency, but I would be mostly talking about the sharing of information for persons with disabilities. When the Sendai framework policy tracker looked at all the member states, only 81 states out of the 193 member states have policies related to persons with disabilities. That is not even 50%, around the world. So how do we enhance transparency? A couple of bullet points I would like to share. One is by providing timely and transparent reports with details of persons with disabilities, mainly the impact, what was the outcome, how the finances were used and all that. Timely evaluations. When we look at the government machinery, many times evaluations, ongoing evaluations may not be very prompt, or it may not be in the public domain, the reports. So that can be, as a to-do list. Interagency groups, already it has been talked about. In Kerala, we have interagency groups. Of course, it was anchored by, initiated by Sphere India, anchored in the State Disaster Management Authority. We still have it in all the districts of the state. We would rather like to call them as geo-NGO coordination, because the district collector chairs the IAG network meetings in all the districts. So it is a tool for transparency where the government as well as the NGOs come together to share the reports, resources, human resources and all that. And a robust grievance redressal mechanism should be there. In 2018 floods, after the 2018 floods, every district had a online digital platform wherein people who are affected by floods could register their grievance, and they get a token receipt, a number issued digitally, and they can check it and see where their grievance is now and what is the progress. And if there is no progress, again, they can look at it after filing a complaint to the DDMA district collector. Community connect, of course, it is needed, especially organizations which work exclusively for persons with disabilities. We have a couple of them in Kerala. They are also registered in IAG networks. To mention one is Tanal in Ernakulam, who are trained by SDMA, and they exclusively work and go for rescue and evacuation for persons with disabilities as well as the elderly. Updated data of PWDs to be available. In 2015, Kerala was the first state to do a household census of persons with disabilities. As I mentioned earlier, we rely on the 2011 census still. And now I think even Tamil Nadu is looking for a detailed census. So after the advent of RPWD Act, we do not have a number actually speaking. So to mitigate that issue, let us have data of persons with disabilities to be available with the local governments, like local panchayats. It should be available where they live, what is their type of disability, what additional requirement do they need, all that, the assistive devices that they use. Making websites, and we have many applications, Android, iOS applications that we have. Are they disability friendly? We have to do a disability access audit. The website should be, we have SDMA websites, we have our own NGO websites. Are they disability friendly? We should look into that. One major issue that we found was that we have many toll-free numbers. To name name one is 112, the emergency response number. Person who cannot speak, how do they communicate to them? How can they communicate? What do we expect that how they communicate with them? So it is in this context that in Kerala, we developed this WhatsApp video call facility was already there, but we developed a toll-free number for COVID affected people who can talk in sign language. So we had a panel of members, including the sign language interpreters. We received around 400 video calls. So this is easy to do, but unfortunately, we do not have. Even the disaster control room numbers are not disability friendly. They cannot call a video call. Making early warning disability friendly should be our priority. All programs to have ISL interpreters. Recently in Kerala, there is a government order which mentions that all government programs should have a ISL interpreter. We have guidelines. We have NDMA guidelines of 2019 regarding persons with disabilities and inclusive disaster risk reduction. In 2016, Kerala published a handbook on disability and DRR. Even our legislations also, at least the abstract of it, at least the gist of it should be in Braille or in ISL. Additional support during emergencies to be ensured for persons with disabilities, especially social security schemes, and added financial support to be given to them, involving them during disaster planning and decision-making process. So these are some of the action points where we can ensure transparency for persons with disabilities. Just I will quickly wind up in another 2 to 3 minutes, giving an example from Kerala. Over last 10 years, we have been implementing this project on disability inclusion in disaster risk reduction, starting from 2015. I'm not going to read one by one, but over a period of last 8 to 10 years, we specifically trained around 3,000 persons with disabilities across all the districts on disaster survival skills, first aid skills. And we have 24/7 helpline with video call facility in sign language. We have an online MOOC course for the first responders. So it is not necessary that only the persons with disabilities speak in sign language and we do not understand. So we have initiated that the first responders like policemen, the fire brigade people, and the Abda Mitra volunteers also learn functional sign language. So we developed a vocabulary of around 500 plus words in sign language, and now it is undergoing audit. It would be coming out as a MOOC course run by the National Institute of Speech and in 2018 floods, just to give some examples, around 8,600 persons with disabilities' lives were affected. Around 40,000 assistive devices were damaged or lost due to floods. It's a very big number. We got it from the Social Justice Department, being the mandated department to look into the affairs of the persons with disabilities. And this number was put in public domain, and crowdsourcing and many other donors, CSR funds were utilized to supply the resources, especially assistive devices. So to enhance transparency, the numbers should be available in the public domain. The houses were also damaged. Around 300 plus houses of persons with disabilities were fully collapsed. And as DMA and UNDP came together with a project known as Pratyuthanam, wherein 25,000 was given as an additional assistance. Those who are familiar with the NDRF, SDRF norms can very well say that we do not have any additional assistance, financial assistance for persons with disabilities or any other vulnerable community. So in 2018, we we introduced this concept as a first attempt to address persons with disabilities, persons who are living with cancer, persons who are undergoing dialysis, widows, 4 types of categories, people, and we gave them additional financial support. And to ensure transparency, the Honorable Revenue Minister himself wrote to all the beneficiaries, that is 4,569 letters. We sent it by post, mentioning that you are, you deserve this amount and how you should be rebuilding your house. And we also enclosed this brochure as to how they should have the toilets, how they should have their ramps, railings, and all that. So it was like a personal connect, and they are also aware that they are deserving and they should be receiving this 25,000. And in case they are not receiving it, they have to call back in a number. So ensuring that it is, matching the need and the demand. Already AAP has been discussed. I'm not again going to it. We had this 2024 Wayanad landslide very recently, and we have an exclusive chapter on social inclusion in the PDNA document. Those who are interested can just browse through it, Google it, wherein children, tribal communities, elderly, persons with disabilities, migrant laborers, extreme poor, and gender minorities were all included. And the details are given as taken from the SJD department. Disability friendly training materials. We have materials in Braille, sign language, big fonts. It is very easy to do. Just increasing our font size in a Microsoft Word. So to help persons with visual impairment, low vision, so that they can read. Even elderly community in Kerala, we have the highest in India elderly community. 16% of our population is elderly. So we have all these materials accessible and available. Early warning in sign language also is very crucial, and we do not see it across the country, but we have to ensure that sign language interpretation is available, at least if there is an orange alert or a red alert. So that also we can look at. As I mentioned, we have this website which is accessible. Accessibility tools are available. So like that, we can ensure that persons with disabilities have all the information that they need. One big challenge is regarding the maps, especially for visually impaired people, how to make them interpret the maps. Some agencies are doing tactile printing of maps. However, it is very expensive. So again, this is one area that there is a challenge that. So thank you for this time. I hope I covered a little bit of information with respect to disability inclusive transparency in DRF. Thank you, and over to you, Prabha.
Yes, thank you, George sir. Thank you so much for being very detailed on your presentation and all your examples, especially from the Kerala, how they are leading the social inclusion in even PDNAs is very inspiring. Thanks a lot. I would like to move on to the next speaker, Mr. Marshal Kumar. Sir is, I'll just take a minute to introduce Mr. Marshal. Sir is a specialist uh, worker in urban poor community development, environment and disaster risk reduction. He is currently serves as a manager with HCL Foundation, CSR arm of HCL Technology Limited. He has been instrumental in settling of HCL Uday operations in Chennai and Madurai in different capacities to bring the development agenda and sustainable community interventions through CSR. Over 10 years of professional experience in the field of social work, teaching, training, DRR, and NGOs and INGOs management. Prior to his tenure in HCL Foundation, he has worked as an assistant professor in DRBCC, Hindu College and Loyola College, Chennai, in the field of social work. I am very happy to invite Marshal sir to give us a perspective of CSR in the transparency model. Over to you, sir. Thank you.
Yeah. Hello. Am I audible?
Yes, sir, you're clear. So you can go ahead.
So allow me to kind of share the screen and would like to take you through a quick kind of presentation, which would really help, put my thoughts here. So
Yes, sir.
first of all, again,
You should be
yeah,
able to share your.
hope you could able to see my screen. First of all, thank you so much for having me here, and of course the wonderful panelist actually enlightened all the participants here, and in fact thrown so much of information and then important, very pertinent issues and challenges definitely. In terms of transparency and governance and related kind of in DRR. And my role is pretty much is to throw some idea about, kind of corporate social responsibilities, otherwise known as CSR. Much of you must be familiar of this, right? Hope my screen is visible. So today I'm bit of taking you through how we can still, HCL, a kind of HCL Foundation has this, kind of arm, which are really helping to build kind of trust and in fact accountability or resilience, and this related ecosystem for almost a kind of decade. And yeah, I would like to take you through about how we are looking at, and in fact how CSR can also, it's not more of a heavy data driven, but of course an idea basically around uh, disaster risk reduction, governance, and in fact related. And what you could able to see it here is more of how it is also clearly highlighted in the document or disaster risk reduction, governance, and development. This a phrase really important. What you see is this fundamental principle of good governance. It's basically to how we bring all the stakeholders important lead to have having this humanitarian lens in place, and then ensure that we are bringing the efficiency in kind of capacity building of all the systems or kind of multi stakeholders, so that there is a law which gives a kind of transparency and equality and equity, in fact, something related to more of community centric and people centric. And then there is a concern, in fact, there is an accountability related to a kind of good governance. So now, as you know, the good governance is pretty much discussed everywhere through in maybe the ESG or kind of CS or any forum. So it's in the limelight, and then for a kind of decade or almost over a decade, I think people are talking about how transparency and accountability is into built into any kind of institutions. In fact, private or government or different other infrastructures or kind of systems. So, as rightly the union minister also highlighted during that, disaster management bill to the act, in which highlights that the aim of this bill, there's to increase transparency, accountability, and in fact, efficiency in disaster management. I really appreciate that this is already there in our system now, and it's just live. So, yeah, am I audible? I mean, just yeah. Just want to check because my
Yes, sir,
screen is,
you're audible.
yeah, great, thanks. So what is transparency? In fact, in DRM is very important and pertinent is about having the information is the key. And coming from a company like uh, information technology based companies, which really talks about information as very important and pertinent. So are we going very open source or a kind of open to share information is very critical nowadays, but it is very important in terms of transparency. But any systems or any kind of operations or any kind of efforts, I think we could able to see the trend of instead of going open, rather we are going for further a closed door approach. And definitely if not a kind of open sharing information is available publicly, so that in any disaster situation is going to be highly risky. So it is so important that how we kind of create a transparency which is open and share and more of information which is accessible to anyone, particularly people are at risk or maybe at risk. So and of course the pertinent is more of how we have this financial also included, which is bring a kind of clarity and honesty, and there is a clear agenda where we are on the same page, and then making it more of an inclusive rather an exclusive. So I think the fundamental of how this fund is also being come and go out kind of system input or output. It's just very important and critical when it comes to transparency, particularly in DRM. So of course, when we are looking at how we are bringing in a kind of collective effort, and then through having the multi-stakeholders approach, and definitely community involvement and accountability is very key. Where previous speakers were all about highlighting how we can involve the community and community centric and bringing all the inclusions, and then or more of consent decision has been taken through a kind of a community based intervention is very pertinent, and then further being can be accountable through audits and then findings and then whatnot, which is very, very important in kind of any transparency related to DRM. Why CSR? How it is very important in CSR, and then transparency. As to you, if you just go to any of the domains, or you want to open up to search engines, you could find definitely that CSR also brings a lot of transparency in a system. In fact, it is one of the important tool in terms of reporting, and then companies which is particularly important to fund and make sure that monitoring and reporting is there. So such transparency is available publicly. So for example, would like to note if in India, I mean anywhere, there are companies which they'll be interested to share their progress annually through a kind of what they call it a sustainability report, or otherwise formally a business, sustainability BSR is very pertinent of a kind of case where every company is so interested to fund and being audited, and then come out publicly to share the reports about how their investments and the company as such is more of very transparent on helping the environment or community or people. In fact, their operations is also related to that. So I think this ecosystem is very enabling, and then companies which already have the ecosystem bringing the same into different other CSR based foundations. Yes, it is helping the reporting and monitoring part of it. It is open and public. Yeah. So so transparency is built in the companies in CSR already. I think this ecosystem can be taken into different other systems and efforts, and particularly when and maybe implementation agencies, what otherwise the NGOs, or very closely working with the corporates, the corporatization of NGOs, the mantra of NGOization of corporatization is how looking at can build around the transparency and accountability is very important and interesting, is still evolving here. um, of course, some of the idea of how transparency can CSR can contribute transparency is basically through building a kind of platforms which provides more of enabling systems. I think recently, I mean, the technology helping us to give a kind of more of apps, and then kind of assets and risk, and technology is highly involved to create such platforms, and in fact early alerts. And then we could able to see the trends is how such platforms helped. We are moving from minimum loss of human lives or to zero lives, and then, which is evident now in so I think this platform is really helping to bring the kind of alerts and risk communications very early, and ensuring the ecosystem is already still building on very strongly. So where HCL, or in fact the CSR ecosystem, is very interested to involve in such kind of efforts or platforms. Of course, financial disclosure and audit, it is very challenging to sometimes there are non-disclosure policies or different other policies, but difficult when it comes to disaster. And of course, there should be a very transparent system where, in terms of using the funds or response or any through relief or whatever funds available, I think there should be a common forum where that should be kind of disclosure, and which will help the ecosystem very transparently. As mentioned earlier, the community-led planning through kind of look forming the disaster committees or trainings and related to transparency and accountability is very key, because it brings also from kind of strengthening across all the level of stakeholders. So or approach from bottom to up, or up down approach. And it's just very important that how we bring community in the center of all our plannings, and then take the ownership and transfer the ownership to the community, which is very important for any sustainable work. Is key in transparency. As mentioned, there are tools which can help the citizens and throw back. It should be a two-way communication or multi-way, where there should be a feedback system, and then work on feedback system, and then recover, or help the system to be more resilient. And this is very important. And CSR can also contribute, or contributing and transparency in those areas. So um, uh, and of course, Mr. Bhatt was already mentioning about how impact assessment can help, and it can be post or pre whatever existing programs. I think it is very important that it is good that we should come back openly, that there is a way where we can grow and learn and rectify, in fact help the system to very very accessible, important to all, taking care of the last mile approach also. As mentioned already, I think the technology is helping us now in a way to help to understand the gravity of the problem or situations through available resources, including the drones or technologies, satellites, which is readily available with us. It is how HCL or CSR or any of the members here who take kind of advantage of using those technologies, pushing into the systems, and then coming up with very a kind of a resilient approaches. It's very pertinent. So I think I would like to move on to how HCL is looking at and as a foundation, we were helping to strengthen the resilience through working with closely with different institutions and partners, so that transparency is cross-cutting across all the result areas are important to look at how we bring the resilience, and through the resilience there is a transparency, and in fact through accountability of bringing all the stakeholders. I think highly appreciated by IAG, which formed in Kerala, which is highly backed by HCL Foundation, of how to strengthen system. It's still functioning and helping the KSDMA instill in different other forms and ways that IAG or IAC could really help to bring the multi stakeholders, and then there is a transparency built into it. And of course, this forum, like this Peer India Academy, is also way backed by HCL previously to institutions, how humanitarians, and related kind of capacity building taken across to all different stakeholders or individuals to create a larger awareness and participation and a kind of discussion and consultations is what we are looking at, more of strengthening the existing kind of institutions is what we are looking at now. So of course there's a challenges which I felt working very closely with the different stakeholders in recent times, that how an implementation agency or NGOs or stakeholders or governments that bring in a kind of dashboards, real-time dashboards, which is real-time and functional, to throw more idea about collective efforts or localizations or fund, and then there is I think dashboards should be available at different level from DDMA or SDMA, whatever level. I think there should be a data driven backed information and robust kind of reporting mechanism which really help each other to look at how a transparent ecosystem can be built. I think it is good. Of course the transparency is not of course it is an individual responsibility, but when it comes to kind of disaster, and it is a very collective effort, and then not necessarily, or identifying that problem finding instead of more of collective responsibility to address the issue, where we can have a larger accountability and transparency, which particularly person or community who are kind of challenge or risk or victimized during those kind of situation or disasters situation. So I think it is a more of collective responsibility, and is important and key. And how we bring in more of innovation through a smart approach of how we're going to plan it in a way that it is sustainable, resilient, and then it is having all the smart kind of goals planned into it, and then the transparency is, it's not kind of ideal. Definitely it is possible to bring it on action on the field at all levels. So this is what basically I'm looking at. It would be good that we still could able to come together and work on it. I mean, all the stakeholders here can suggest, or in fact I'll be open to listen to some of the ideas or existing models. We really love to take it up or help to build it. With that, I think thank you so much for the opportunity of having me here. Really absolutely wonderful to listen to all these panel members, and then look forward if there is any questions or challenges. Yeah, thanks.
Yes, thank you so much, Marshal sir. Thanks a lot for giving us a very clear picture of the CSR perspective in transparency. With that, we come to a conclusion to the experts' insights in the session, and we'll move on to the Q&A. We already have a couple of questions, and thank you, Henna ma'am, for giving more insights in the chat box. Thanks for that. And we have a couple of questions from the participants. I'll read out one by one, and relevant panelists can answer them. So, George, sir, you were talking about decision making and involving disabled community in decision making. Somebody has asked to explain. I mean, you have answered the question already, but I would like you to answer here a little more detail on how disabled people can be included better in decision making process.
Yeah, so it's a very relevant question. Many a times we mention about this challenge, but we do not do much about it. What we can do is, one is the DPOs who work with the persons with disabilities. If we have IAG networks in your district, maybe your NGO can be registered in the the IAG network. Secondly, get the decisions or get the suggestions of persons with disabilities discussed in this network meetings, so that they are heard. Another thing is, when we mention about enhancing their participation, we have to see that they have a place to come, Many a times the programs are held in a place which is not accessible, which do not have lifts, elevators, or not on the ground floor, so on and so forth. So we have to ensure that, and also we have to have a sign language interpreter wherever persons with speech impairment are participating. So there are logistic arrangements as well as functional arrangements to be ensured so that their voices are heard. And most of the persons with disabilities are using smartphones. So over the website also, we can request for their suggestions. So while preparing the RPWD Act and other policies, they have done likewise. However, with respect to disaster risk reduction and management, we may have to do more to ensure that deliberately their voices are heard. That's what I feel as of now. Over.
Thank you, sir. Thanks a lot for the answer. I hope it cleared the question. Also, okay. Another question is about data. And when Marshall sir was talking about data and data privacy on how he mentioned about HCL Tech, we have a couple of questions around the same on how data privacy can be ensured and how we know how important data is, but there is a misconception that data transparency means that sensitive information will also be handled and will also be given away. So, how do we answer that and still be transparent?
Handling is bit difficult always because there is a sensitivity around it, and it is so difficult to sometimes it's so difficult to bring data very publicly, which can be very manipulative, can be constructive, or sometimes it's very critical that it may lead to maybe right or wrong. Maybe that is kind of very judgmental issue, but of course it is important that how we bound ourselves within the disclosed area, where we can very confidently that disclose information, which is very important to help the kind of have a better narratives that which can help the kind of understanding between one or two or different stakeholders together. So on the merit of what is agreed to share or disagreed to share, and of course it is so sensitive that it sometimes it's case by case, it's very difficult to address. So I think there should be minimum common understanding or agenda of how to, where to, and who are the, based on the kind of understanding the stakeholders and how to share those informations privately or publicly is so critical and important. And sometimes most of the times the data is can be kind of at risk, and particularly in those age where kind of technology is available, people are more interested to share the information so quickly through social medias, voice their opinions. And it is important that how there is a free speech, free flow of information is very important. There are different censorship is also there. So how this is going to be handled by sensitive, I think is what the age we are facing is very critical. So people have to come and critically accept that there are challenges when we are handling information, and that of course bound with some non-disclosures of information, and pertinent when it is required to share openly and publicly. So it is very sensitive around. When we have this ecosystem, particularly when there is a whole lot of misinformation, can lead even more, create more disaster risk impact than as we presume. So I think it is still debatable. There are technologies helping us in a way, but of course it is also equally affecting the free flow of informations. I think there should be a minimum standard goals which people should come on this a platform to share such information. Yeah.
So, thank you so much for answering that, sir. And the goal to data security is accepting that these challenges do exist, acknowledging them and working towards them. Also, talking about these stuff, I have another question around it. This is a common question and it's kind of not very uh, usual formal question that you would expect. There is a question on how there are myths and misconceptions around data privacy, data transparency in disaster risk management. So this is a common question, and anybody from the panel can answer this.
I can share some thoughts, not answer, but some thoughts on this. And I think first is very important for the organization, may it be an NGO, a local organization, INGO, maybe an authority, but to see the objectives of transparency. So as I understand, for us, the objective of transparency is that the people who are affected the most know where the money is coming, what actions are being taken, etc. And in that case, the data, what data will be useful for that purpose and accessible to them, that's from there we should start building the data related transparency and therefore the data sharing plan, etc. Otherwise, we may end up, sharing everything with everybody with a very high cost, but not really achieving the purpose. In fact, exposing to very difficult possible backlash in terms of either affected people or authority, other NGO, etc., etc. So I think the objective of why we are doing, and each organization will have to work on that part. Then there are systems and data scientists and other people who can help you do that. But that objectives of why we are doing this data for transparency and accountability, that it should be very well worked out. That's in our experience as we keep on failing on that, but then we learn and we again incorporate some of the changes. Thank you.
I'd also like to add to that instituting some mechanisms and sharing information with the government, like Mihir Bhai was talking about, under the NDMA Act, there has to be a public disclosure of what kind of aid was provided. That could be a very general and a very generic thing, which should be kind of strengthened and improved and looked upon. But when it comes to data privacy, every organization has their own way, and some consider that it's a breach of confidentiality if they, for example, share a list of beneficiaries who are from marginalized communities and put it all over the place, and you don't know how others can interpret that kind of information. So we need to be a little careful and also kind of not because that data can be kind of used in any other mishandled, or there could be many other repercussions. So I think that should not be encouraged. I had one point which Marshall was making about the centralized dashboard, a dynamic dashboard which can be instituted with all the stakeholders together. This is a vision that we as peer were also wanting to kind of put across. But in terms of needs assessment, in terms of gauging and understanding on the gaps, in terms of no replication of the same response activities within the same geographies of a response of an emergency situation, and leveraging and pooling of resources. I mean, that should be the vision of having a very live, a very dynamic dashboard into existence. I put out some projections on, we had some discussions on a similar webinar last year, when one of an internationally accredited spear trainer talked about that in other countries they have come out with an app which is instituted, which is an app wherein you have some scientifically determined technical standards on water and sanitation, on food and nutrition, on protection. so that whenever we are coming out with a needs assessment, it does collate and calculate and put out those projections. You don't have to do it manually. So that kind of thing can also, it's a bit ambitious, but we could always customize it and relate it to the minimum standards of relief and response that every state of India has, and on which Spear had also embarked on understanding that there has to be some technical support also to be provided to some of the SDMAs on how best to come out with standardized relief codes, which can then feed into that dashboard or that application. These are some of the initial thoughts, but we can always open out these ideas to a wider group, to a broader group, for rendering and ensuring more transparency and accountability in these processes. Over.
Yes, thank you so much, ma'am, for supporting and adding to the points of the other panelists. And with that, we come to the end of the webinar. Thank you so much to all our experts for taking their time to this very, very important topic. And we expect more and more sessions to come under the accountability to affected populations vertical. We are very happy to receive any feedback or any recommendations from the participants of what kind of topics and what kind of insights you would like to hear and include in our coming Sphere India Academy sessions. Thank you so much. The PPTs will be shared with the participants along with the recorded version of this webinar on YouTube. Thank you so much, everyone, for attending. Thanks. More and more thanks to the panelists for joining. Thank you so much. We'll see you in the next webinar.
Thank you so much. Henaji, thank
you very
you.
much.
Joe, so
Thank
good to see you.
Thank you,
Good to
everyone.
see you.
You are losing hair, I'm gaining hair.
Good, good.
I will share some.
Yeah.
Marshalji, good to see you in person, and
Same.
everybody at the panel, and the participants. Best regards.
Excellent.
Thank you.
Thank
Thank
you.
you.
Thank you.